Does your skin look like this? Or have you seen skin that looks like this? By the time you finish today's video, you'll be able to recognize some of the characteristics of severe seborrheic dermatitis, sometimes called dandruff. You'll also learn some of the main things that we dermatologists use to treat these symptoms and to help to improve the condition of the scalp. When you look at the scalp on this film, things that stand out are the severe dryness, the gray scale, all the keratin and scale production. Dandruff, or seborrheic dermatitis, comes from an overproduction of yeast on the scalp. This yeast naturally lives on the human scalp. It's true for all of us. It shouldn't be thought of as an infection that is caught from someone or from something. It naturally occurs as a normal inhabitant. For some of us, unfortunately, it overgrows just a little bit too much, and it doesn't change, and the scale doesn't go away until you use things to help calm down the production of yeast, and that way you get your normal scalp back. There are some racial and cultural differences as it relates to the scalp, scale production, the quality of the hair shaft, tendency for shampooing, and even the severity of dandruff when it shows up. For example, in the African American patient, our hair shafts are thicker, they're more tightly coiled, and they involve less oil or sebum production. And the sebum that is produced has a harder time traveling down the hair shaft to reach the scalp and nourish the scalp. As a result, our scalp has a tendency for more dryness, more scale production, and a higher tendency and frequency for dandruff. And therefore, because of this extra scale, and this extra dryness, we don't shampoo as often, causing more dryness. For the Caucasian scalp, for white people, the hair shaft is thinner. The hair is more straight and wavy. There's a greater amount of oil or sebum production, and it travels with ease down the hair shaft to nourish the scalp. In fact, the main complaint is that, the scalp becomes too oily, and therefore there's a higher frequency of shampooing to get rid of this oily scalp. When dandruff does occur, it usually occurs with less scale production, less frequently, and less dryness. Of course, these are generalizations. There are probably several exceptions to the rules that I just pointed out. For the case that we see here, the case is relatively severe, and some of the treatment considerations could be as follows: to use fluocinolone 0.05% solution, massaged into the scalp twice daily. I usually like to use loratadine 10 milligrams twice a day with many inflammatory skin conditions. This is definitely a good example of one. Also, a good consideration is prednisone 5 milligrams once per week, unless the patient has a risk for diabetes, in which case you would hold the prednisone use or limit its use to a one-time dose only. As far as the medicated shampoos that are prescribed, a standard for seborrheic dermatitis of any kind on the scalp should be ketoconazole 2% shampoo. But for a case this severe with very thick, copious scale, you could also include salicylic acid 6% shampoo as an adjunct and use both of these shampoos in a way that you lather and let the lather sit with contact of the scalp 5 minutes before rinsing, and carry that out at least once a week. But if tolerated, even greater frequency, multiple times per week. I'm Dr. David Bryant. I'm the proud owner of World's Famous Dermatologist, a dermatology practice in Stockbridge and Decatur, Georgia. We help patients from all races and ethnic groups, but we're probably best known for our expertise in Black skin. The dermatologist that you go to and trust does not need to be a Black American like myself to be qualified to work on Black skin, but whoever you're trusting with these kind of conditions should have experience with a large volume of Black patients and be very experienced with skin conditions that affect darker skin types. I hope you enjoyed today's video. If you did, please like, comment, and subscribe to the channel. Please leave your comments below. I will consider your comments and questions the next time we cover similar content. I look forward to connecting with you on the next video.